COVID-19 test for past infection. The antibody or serology tests look for antibodies in your blood that fight the virus that causes COVID-19. Antibodies are proteins created by your immune system that help you fight off infections. They are made after you have been infected or have been vaccinated against an infection. Antibodies help you fight off infections and can protect you from getting that infection for some period of time afterward. How long this protection lasts is different for each disease and each person. Antibody tests should generally not be used to diagnose a current infection with the virus that causes COVID-19. An antibody test may not show if you have a current infection because it can take 1 to 3 weeks after the infection for your body to make antibodies. How to get an antibody test. Decisions about testing are made by state or local health departments or healthcare professionals. Antibody tests for COVID-19 are available through healthcare professionals and laboratories. Check with your healthcare professional to see if they offer antibody tests and whether you should get one. What your results mean. If you test positive, a positive antibody test result shows you may have antibodies from a previous infection with the virus that causes COVID-19. Antibodies to the virus that causes COVID-19 provide protection from getting infected. CDC is evaluating how long protection from antibodies might last. Cases of reinfection have been reported but remain rare. You may test positive for antibodies even if you have never had symptoms of COVID-19. This can happen if you had an infection without symptoms, which is called an asymptomatic infection. Sometimes a person can test positive for SARS-CoV-2 antibodies when they do not actually have those specific antibodies. This is called a false positive. Talk with your healthcare professional about your test result and the type of test you took to understand what your result means. Your healthcare professional may suggest you take a second type of antibody test to see if the first test was accurate. If you test negative, you may not have COVID-19 antibodies. This could be because you have not had an infection with the virus that causes COVID-19. You could have a current infection, been recently infected, or been recently vaccinated. It typically takes 1 to 3 weeks after infection for your body to make antibodies. If you are infected, you may get sick and spread the virus before you may develop antibodies. Some people may take even longer to develop antibodies, and a small portion of people who are infected or vaccinated may never develop antibodies. Sometimes people test negative for SARS-CoV-2 antibodies when they have specific antibodies. This is called a false negative. Talk with your healthcare professional about your test result and the type of tests you took to understand what your result means. Regardless of whether you test positive or negative, the results do not confirm whether you were able to spread the virus that causes COVID-19. Until we know more, continue to take steps to protect yourself and others. Self-testing. Testing is critically important to help reduce the spread of COVID-19. If you have symptoms associated with COVID-19, you should quarantine and be tested. If you are unvaccinated and think you are exposed to someone who has COVID-19, you should be tested. Fully vaccinated individuals should follow recommendations for testing. If you need to be tested for COVID-19 and can't get tested by a healthcare provider, you can consider using either a self-collection kit or a self-test that can be performed at home or anywhere else. Sometimes a self-test is also called a home test or an at-home test. These self-collection kits and tests are currently available by prescription or over the counter without a prescription in a pharmacy or retail store. Currently available self-collection kits and tests are used for the detection of current infection. Read the complete set of the manufacturer's instructions before using the test. Talk to a healthcare provider if you have questions about your test or your results. Types of specimens. Some tests require a nasal specimen that can be collected using an anterior nasal swab or a nasal mid-turbinate swab. Other tests require a saliva specimen. Prepare to collect a specimen. Wash your hands. Open the box and follow the manufacturer's instructions included with the specimen collection or test kit to collect your own nasal or saliva specimen. If you don't collect the specimens as directed, your test results may be incorrect. Once collected, send the specimen to a testing facility or use the specimen as described in the manufacturer's instructions to complete the self-test. Performing the test. Follow the manufacturer's instructions exactly and perform the steps in the order that they are listed. The manufacturer may also provide other resources such as quick reference guides or instructional videos to help you perform the test correctly. Tips. Store all test components according to the manufacturer's instructions until ready for use. Check the expiration date. Don't use expired tests or test components that are damaged or discolored. Disinfect the countertop, table, or other surface where you will do the test. Don't open test devices or other test components until you are ready to start the testing process. Read and record test results only within the amount of time specified in the manufacturer's instructions. A result read before or after the specified time frame may be incorrect. Don't reuse test devices or other components. Reporting results. Give your results to your healthcare provider, or if you do not have a healthcare provider, to your local, state, or health department. Some self-tests have an app that will automatically report your results to the appropriate public health authorities. If your test is positive, tell a healthcare provider about your positive test result and stay in contact with them during your illness. If your illness becomes severe, seek medical attention. To avoid spreading the virus to others, follow CDC recommendations. As much as possible, stay in a specific room and away from other people and pets in your home or place of residence. If possible, you should use a separate bathroom. If you need to be around other people or animals in or outside of the home or place of residence, wear a mask. Don't share personal household items like cups, towels, and utensils. Monitor your symptoms. If you have an emergency warning sign, include trouble breathing, seek emergency medical care immediately. Tell your close contacts that they may have been exposed to COVID-19. An infected person can spread COVID-19 starting 48 hours or 2 days before the person has any symptoms or tests positive. By letting your close contacts know that they may have been exposed to COVID-19, you are helping to protect everyone. If your test is negative, a negative test result means the SARS-CoV-2, the virus that causes COVID-19, was not found in your specimen. If you took the test while you had symptoms and followed all instructions carefully, a negative result means your current illness is probably not COVID-19. However, it is possible for a test to give a negative result in some people who have COVID-19. This is called a false negative. You could also test negative if the specimen was collected too early in your infection. In this case, you could test positive later during your illness. Some self-tests are designed to be used in a series. Serial testing is when a person tests themselves multiple times for COVID-19 on a routine basis, such as every few days. By testing more frequently, you may detect COVID-19 more quickly and could reduce the spread of infection. Some self-administered tests come with more than one test and instruction to perform serial testing. If your results shows invalid or error, sometimes the results are not clear or inconclusive, and the test is unable to tell you if your results are positive or negative. If the display on the test shows an invalid result or a test error, the test did not work properly. If this happens, refer to the instructions for use in the package insert and contact the manufacturer for assistance. Invalid results can occur for many reasons. Your specimen may not have been collected correctly, or the testing instrument may have malfunctioned. Invalid test results are rare but can occur. Regardless of what your test results are, you should always review the results with a healthcare provider. The healthcare provider will consider the test result together with your symptoms and possible exposure in deciding how to care for you.